Dr. K, Dr. Kevin Kavanagh. He's the retired physician, also founder and president of Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
All right, I guess we go start right into the vaccines. When we are told that Pfizer and mRNA vaccines are 90% effective against the Delta variant, what does that mean?
Well, I think it means, and I have to say I think because the data is a little conflicting, but the latest I'm seeing from the Public Health of England states that it means that it prevents hospitalizations 90%. And they also have a statement in there that even though a lot of people are getting infected and developing more cases, the vaccines appear to be preventing hospitalization. So I don't think it is as effective as that in preventing actual cases or symptoms from a person that develops COVID-19 from the Delta variant.
We're hearing more and more about that Delta variant. Is it getting worse in the United States?
Definitely. It is doubling. It's right now 99% of the cases in England. I suspect we're going to follow that path. It is much more infectious, at least 60% more infectious than the prior UK or Alpha variant. And that, as you know, was 60 to 70% more infectious than the wild type virus. So this, if you look at what we were faced with last year, is probably twice, if not more, infectious as that. And it also appears to be affecting the young, just like the old, which is a huge change. So younger people, they need to get vaccinated. This isn't the same beast that we were dealing with last year.
Going back to that original question there, these Pfizer and Moderna vaccines, 90% effective against the Delta variant. What about Johnson & Johnson? Is there any research in that regard?
Well, the last thing I heard is they're still waiting for the data. I would suspect, similar to the wild type virus, it's a little bit less effective, but still will give you some protection. And remember, hospitalizations are great, but with new data coming out, we also want to avoid getting long COVID and COVID itself. So my advice is, for me, I'm still wearing a mask when I go indoors in a crowded retail setting, especially if there's not good ventilation.
Is anybody wised off at you?
Not yet, because I think I'm an older guy, look like I'm not in good health, would have to be wearing a mask anyway. So I'm not a good litmus test for that.
No, you're not sickly. You don't look sickly. Okay, well, what about these you mentioned long COVID patients, this study showing MRI changes in the brain?
Right, and it's looking at brain scans, and it's a new study that came out, and it came out of England, out of Oxford. And this study looks at approximately 300 and some patients who have had pre-COVID brain scans and then post-COVID brain scans. And they were able to match this with controls. And in England, they actually have a repository or bank of brain scans so they can do these type of studies. To me, that's a big plus. We don't have that in the United States. And they were able to show changes within the brain of these patients, primarily around the centers of taste and smell, which you'd expect because a lot of people have problems with smell. And that's not really good news because it's showing an anatomical change that relates to a patient's symptoms. And these areas also can be fairly close to the areas of the brain that has to do with memory. As you know, a lot of the patients that have the so-called long COVID complain of memory problems, brain fog, difficulty concentrating, and this really does add credibility to those symptoms. Unfortunately, if you're showing changes in the brain on the brain scan, that may not totally reverse. A lot of people are going to compensate so that they won't have the symptoms anymore, but you don't want to have changes on a brain scan and lose brain matter. So again, another reason why we should be paying attention to COVID and not out there just pretending like, hey, everything's fine, we're going to open up. I really do think we need to take this virus seriously, especially now that we have this Delta variant.
And back to the Delta variant, this is something maybe you can help me understand. The United Kingdom has vaccinated 80% of the adults there, but the Delta variant cases are rising. So what's up with that?
Well, it's evading immunity. Now, most of the 80% are people that have had only a single dose. Again, that's why you need both doses of the vaccine. For those of you that had COVID before, well, I would get the vaccine on top of it because you need to get your immunity up as high as you can. Remember, all of this immunity we're talking about is to last year's virus. And this virus has gone through several iterations now, and the Delta variant is the most concerning. And if you want to really get depressing, there's a Delta Plus variant, which may actually even evade immunity more, but we're not sure how infectious that is, so it may not be one that really takes hold in the community, and let's hope for that.
Wow. Always good to talk to you, sir, and we will be back together on Friday. Thank you so much.
Thank you, Jack.